Restore Thrive, we're back. Here to give you another quick take today about something we see very commonly, which is pain around the wrist and around the joints of the hand, around your thumbs, your fingers, into your fingers, or even in your palm. Now, the normal way that people deal with this is they'll go to the doctor, they'll get a pill to take, they'll get a brace to use, and we really look at those as really just short-term interventions that aren't really addressing the root cause of what's going on. You may or may not have something going on in your carpal tunnel or in the joints of your hand, but we have to remember too that your hand is part of a larger system. And so if we use the upstream downstream model that we use when we're treating your pain or your dysfunction, we want to look upstream at the guide wires that cross from your forearm and your elbow into your wrist and into your hand, and specifically the soft tissue that you've got around your forearm. Now, this stuff gets a lot of work. We kind of look at this as the equivalent of your calf muscle and how it relates to your foot, in that we do a lot of gripping, a lot of posturing of our hand, typing, texting, things like that. So we get a lot of work for these muscles of the forearm and don't spend much time really stretching them out. So what we find is always most helpful is if we get some direct pressure on these tissues and try to floss them out a little bit, we get the best result in terms of restoring normal range of motion and normal function. So real quick, how to do this. We just need to take two balls. So I've got the mini Supernova here from MWAD and Rogue Fitness, and just a basic lacrosse ball. And what I want to do is match these balls on top of each other. I'm going to lay one somewhere around one side of my forearm and match the other one on top here, and then just add a little bit of downward pressure. Once I've got that pressure, I'm going to start to flex and extend my wrist here. If that hurts, I'm going to keep doing that until it hurts less. If it doesn't hurt, I can reposition downstream a little bit. Again, match that pressure, flex and extend. If that feels okay, I can actually turn my palm over a little bit, get on top through these forearm extensors. Especially if you've ever had tennis elbow, this is a great mobilization to do, so I can get way up towards my elbow, put that ball right on the outside of my elbow where that common tendon insertion sits, put a little pressure in there, and then I can start to flex and extend my wrist. I can add a little bit of rotation side to side, just any sort of motion I can do with my hand. Just explore all the ranges that you have, and you'll be surprised. Movement at your hand, in your wrist and fingers can really light up stiffness up here if we've got some pressure. So other ideas that we have for this, the Voodoo floss band, which we've talked about a little bit as far as treating runner's knee. We can put this floss band around our forearm or around our elbow or even down around our wrist and do some of those same motions. And what we're going to get now is a little bit of compression, a little bit of shearing to pull those layers of tissue apart. We'll get some intermittent compression that helps push some blood flow out, and when you bring that band off your arm, what you're going to get is you're going to see a big rush of blood flow. Things will get red again as you see that blood flow get back into that area you compress, and that's going to help just kind of restore again that normal tissue. So we hope you guys find this useful. If you have any other questions or comments, feel free to leave them below. We'll talk to you again soon.